This is Edward Daniel. Welcome to Me, Med, and More. Before you start, make sure to introduce yourself, ask for allergies, secure consent form, prepare materials prior, do proper drapings, and calculate anesthesia. For lidocaine, it's given 5 mg per kilogram. Lidocaine with epinephrine, 7 mg per kilogram. Here is a sample computation for a 50 kg patient. Chest tube insertion is a procedure where a hollow tube is inserted between the ribs into the pleural space to drain either air, blood, chyle, pus, or other fluids. Indications are pneumothorax, hemothorax, pneumohemothorax, empyema, and subcutaneous emphysema of the chest wall in a patient who has sustained chest wall trauma requiring ventilator support or general anesthesia. Materials needed: scalpel, forceps, surgical scissors, needle holder, mosquito forceps or large Kelly, Vaselinized gauze, silk O with curved cutting needles, sterile gloves, syringe with local anesthesia, povidone iodine antiseptic, plaster, sterile gown, glass bottle system with underwater seal, chest tube. If possible, have the patient assume a semi-upright position with the arm placed above the head. Prep the skin over a wide area of the chest wall with povidone iodine. Do this in outward concentric circles using the sternum, subcostal area, posterior axillary line, and the clavicles as landmark. Drape the area with 4 towels and secure your towel clips. Place the first towel on the side nearest the surgeon. Then place the towels in the cephalad and caudal positions. The last towel is placed on the lateral side opposite the surgeon. Starting at the angle of Louis, which corresponds to the second rib, count 2 to 3 ribs down and locate the 4th or 5th intercostal space along the anterior axillary line. At the 4th or 5th intercostal space, anterior axillary line, infiltrate the skin with a local anesthetic and block with the intercostal nerve branches. Do not forget to infiltrate the pleura. Make a 2.5 to 3 cm long skin incision well into the subcutaneous tissue. Insert a curved Mayo scissors or curved Kelly clamp and cut or separate the tissues so as to create a tunnel or tract in the direction in which the tube is to be inserted. This tract should be directed posteriorly, cephalad, and medially so that the tube lies posteriorly in the paravertebral gutter. Continue developing this tract all the way into the pleura. Remove the scissors or clamp and explore the tract with a gloved finger from time to time to make sure the tract is going in the right direction. After the pleural cavity has been entered, insert the gloved finger to explore for adherent lung and then further enlarge the opening in the pleura by inserting a large Kelly clamp and spreading it. Grasp the tip of the tube with a long Kelly clamp so that the long axis of the clamp is almost parallel to the long axis of the tube. Measure the distance that you want the tube to extend into the chest and either note or mark the proposed point of emergence of the tube with another smaller clamp placed on the tube at this point. If hemothorax is suspected, it is also advisable to clamp the very distal end of the tube to avoid making a mess. Insert the tube into the chest using the large Kelly clamp as guide. Remove the large Kelly clamp as soon as the tube reaches the desired position in the chest, but do not remove the smaller clamp marking the point of emergence of the tube. Palpate to ensure that the tube has entered the chest. Suture the tube to the skin with silk O. Only after these sutures are placed may the smaller clamp on the tube be removed. Connect the tube to the underwater seal chest drainage system. Care should be taken to do this step properly, as this may cause pneumothorax if tube is disconnected from the underwater seal. Place Vaselinized gauze dressing around the tube. Lastly, dispose of the contaminated materials into the respective receptacles. And don't forget to obtain a post-tube insertion chest x-ray to check the position of the tube. I hope to see you in my other videos on me, med, and more.